Many children in Canada are exposed to adverse childhood experiences, or what we call ACEs. So these are things like abuse, neglect, poverty, challenges in the home. And when these happen in early childhood and in infancy, we know that they're associated with long-term health and mental health difficulties. These types of experiences, they get under the skin and they're transmitted from generation to generation. So that means that when we have mothers who have experienced their own ACEs and trauma when they were children, their children are also much more likely to be exposed to these experiences. And that leads to these cycles of difficulty over time.
Our program is now 19 years old, and sadly, we now have the children coming back pregnant with addictions. And we've had, a couple of handfuls of kids already that have come back that we saw as babies, and we know that the cycle is not broken.
The early relationship study is a study that's really focused on understanding how early relationships and the parent-child relationship can act as a buffer or can really enhance outcomes for children who have experienced adversity.
Getting in early, supporting effective parenting, supporting the mother's well-being, the child's development, and most particularly the relationship.
Our research team is really interested in understanding how do we break these cycles of adversity? How do we best support mothers specifically and their young children, especially when mothers themselves have had long histories of trauma and are substance involved? Our project is a partnership between one main site, Breaking the Cycle, which is a program for substance-involved moms and their young children in Toronto. And another partner agency is the Maxine Wright Community Health Centre, which is in Surrey, BC.
Here at Maxine Wright, our guiding principles are around harm reduction. We accept women where they're at, any part of the continuum of addiction and recovery. What we're really hoping for is a new approach that is much more child-focused. We would really like to be more upstream thinking, forward thinking, keep track of these kids a little bit earlier, as Breaking the Cycle does, and really learn from their experience of how to be more proactive and get these supports in place earlier.
Breaking the Cycle comes from an infant mental health approach and an early intervention approach. We use an attachment-based framework because that's what helps us to understand that really safety and security and dependability and predictability are the things that children need most of all.
I think one of the unique things about Breaking the Cycle, it's a wraparound program.
Some of the most important parts of the programming are the instrumental supports that we offer to families on a daily basis. We understand that families need not only our support, but supports from other systems in the community.
Through those partnerships and through co-creation, we've been able to do things that I couldn't imagine. Research has been embedded in the program since it was being planned.
Including a woman with lived experience who was a client of Breaking the Cycle with her son for over 6 years and is now part of our research team.
When you bridge that gap between the science, the researchers, and the practice, and make it a partnership so that the program is moving completely in step with the research informing the programming and the programming informing the next research questions, you can move forward in such exciting ways.
We will have some new skills and ability to really change the trajectory and reduce the adverse childhood events, pay attention to what the effects of those ACEs are, and really reshape the future for some of these families.
We really view the early years as being this window of opportunity where we have a chance to intervene, we have a chance to support optimal and healthy development because children become the adults. They're our future.